questions here. Yeah.
Hi, thanks. I'll start with thank you. This is excellent. So I will say we've built our OHT application really around these principles,
Right.
And been trying to circulate some material and trying to get people up to speed. But it's really nice to be able to just direct them to RISE and say, here's the thinking. So it's been excellent.
Thank you.
I guess the first question, I'm going to have lots of questions. The first question I have, though, is we've been having a lot of discussion throughout this process about quadruple aim.
Mm-hmm.
We keep talking about moving the needle.
Yep.
One of the challenges we're facing as we're looking to refine segments of our population is we're notorious for not collecting patient-reported outcomes, experience measures.
Yes,
I would argue we actually, we don't even measure costs well, but we're probably further along in terms of costs than we are anything else.
Yep.
And I would also say that we have the least information for the most marginalized populations.
Yep.
So that creates a really big challenge when we're thinking about, what are the metrics?
Mm-hmm. How
can we demonstrate change, especially within year one?
Yep.
What's sort of happening, or is there any advice you can give in terms of what you're hearing, in the material you guys have in terms of strategy? I'm sure we're not alone across the province. What are others thinking, and where's that going?
Yeah, so, I guess what we're hearing folks are doing is trying to be very pragmatic of picking a small number of the metrics that they anticipate being able to move, recognizing that those metrics aren't going to be reflective of the full array of either citizens or the population for which they're accountable, and they're also not going to necessarily be reflective of what the many partners on the team can bring to the table. They tend to skew to the more easy to measure, often hospital-based metrics, but I would encourage you to pick a couple of just very pragmatic ones that you feel pretty good about being able to move, but then really try to focus on how are you going to build that data architecture in your first year so it keeps getting more robust. So if you zero in on the RISE brief on data analytics, that's an area where I had a steep learning curve and still have a long way up that mountain of understanding it. But when I was asking people about where would you go for the most robust set of data analytics, time and time again, they would mention IDS, which I don't know if your team is participating in, but it does give you that longitudinal journey, which is very unique, and telehealth doesn't give you the longitudinally linked journey. And it also gives you an easy mechanism to bring your primary care partners to the table, because they can add their data to it. And then suddenly you have a more comprehensive coverage of a sector that's usually neglected entirely. And then IDS, in our conversations with them, has signaled that they're very open to conversations about starting to add the community-based data. So we know that Toronto has a community data intelligence data set that it has helped to create. As far as we know, it never got rolled out across the province, but the infrastructure is there. So a year one possibility would be to say, could we work with that community-based infrastructure and work with IDS so that at the end of year one, we actually have primary care covered and home and community care covered. So the ministry is very aware of the fact that people are sitting around tables trying to do the right thing, but then end up looking at metrics that are skewed to a bit of where we are now as opposed to where we need to be in the coming years. So I would just come back with a forceful argument about we picked these very pragmatically for these reasons, but here are the steps we're taking so that at the end of year one, we're going to be able to have a far more robust set of analytics, including on PREMS and PROMs.
That's great. So I just sort of follow up, if you don't mind. So that's awesome. We've worked very closely with IDS. So just in terms of moving forward around those PREMS and PROMs, we have strategies we've been considering in terms of how to collect them. So can we reach out to you guys and create something within RISE so that we're sharing?
Absolutely. We're thrilled when folks come forward with things that they're doing that they're willing to share. And if we can get that out through the network, and then vice versa, others might say, oh, we're doing something too. And then if you can be working together, one of the many exciting things for me about this transformation is that you have the opportunity to shape it. So your work on patient-reported experience measures and patient-reported outcome measures can help shape where the ministry ends up going in terms of that. So it's a really great opportunity. So by all means, either contact us directly or even better, post it in the community of practice so others see it right away and then they can start to act on it very immediately. But one thing we want to do is as soon as October 9th passes and people have a bit of a chance to get some sleep, we start to talk to people about which parts of their application were they really proud of and want to share with others, so that in that interim period before you get the green light to proceed, you already have some sense of, wow, it turns out the Western folks did this part of the application really well. Let's see if we can get that part, and it'll help our thinking, so when we get the green light, we can proceed much more quickly on implementation we want. We know people don't have the bandwidth now to spend a lot of time helping others, but we hope that after October 9th that will become front and center. So David, do you want to?
Yeah, no, I just make a quick comment. When people asking questions, maybe you can introduce yourself so we know which institute you're coming from, and it's a great opportunity even for RISE, but also for across and among all of us, we'll be able to link afterward during the break, another opportunity to dialogue.
Yes, sir. Are you going to introduce yourself?
Yeah, absolutely. Sorry, I apologize. I should have done that. So I'm Matt Meyer. I work with on the Health Sciences Center. I'm also an adjunct professor here at the Biostats and at the Ivy School of Business at Western, and was one of the authors of the OHT application locally.
Fantastic.
So yeah, I know lots of the folks already.
Great, super. Can we go to folks online, Carrier? There's some folks coming in from the WebEx session.
I have one from online that says, do you have any advice or know of any tools that can help an OHT with a large number of partners, 30 or more, to identify partner goals and values when beginning work on establishing collaborative governance?
So tools and resources. So I guess we put what we have access to currently, we put in the collaborative governance brief. So I would point people towards that. I'm trying to think if there's anything else that's been brought to their attention. Been brought to our attention, not that I can think of, but Heather alluded to the upcoming webinars. One of the things we discussed with the ministry yesterday was would it be helpful to have a webinar or part of a webinar focused on what do you do with the groups that have particularly big partner groupings, but also where their partners are often groups that have more of a regional lens. We're hearing from folks that have that more regional perspective that they're finding it very hard to field senior staff to 5 different teams, each of which has multiple meetings at multiple levels. So I think there's a lot of issues about how do you manage that both the exciting opportunity created by having many people around the table, but also just the pragmatic realities of how do you handle that. So that hopefully will be a focus of an upcoming webinar, and if people do encounter resources, please bring them to our attention. What we were aware of, we talked about in that RISE brief on collaborative governance. Heather?
It's Heather from RISE, and I was just going to say that I think that would be a good question to ask in the community as well.
Yes, absolutely.
Because just some of our own experience, having been able to observe some of the actual Ontario Health Team meetings that are more local to us, we have a sense of what's actually happening there. They have used some ways to kind of think about what the shared goals are and get alignment. So I bet you that's sort of a bit of a let's share what's worked if we've already tried to do something within our own OHT. So I would encourage you as well to ask that question in the community.
Yeah. Fantastic. And someone came up to us at the meeting yesterday, and I blanked out, but he was talking about, I think it was section 5.1 of the application, where he thought it would be helpful to have a simple tool that would allow you to, what was it? Were you in on that conversation? It was something about not auditing, but checking in on your fellow partners' governance practices, just to reassure yourself from kind of fiduciary perspective that everything's in good alignment. And he said, and I encouraged him to post to the Ontario Health Team Community of Practice, because someone might have a tool like that they can quickly get out, and it will help them answer that question 5.1 or section 5.1. All right, so other questions from folks in the room? Yes.
Hi, Lori Marshall from Chatham-Kent Health Alliance and part of the Chatham-Kent Ontario Health Team application. Excellent. So very helpful. I have a question about the quadruple aim.
Yes.
And from a community of practice perspective, recognizing that many of our metrics are going to be very specific to the populations that are chosen. Yes. And yet there is value in having some level of comparability across the different Ontario Health Teams in the event that we have similar populations for those sorts of things. Yeah. I'm wondering how it is that we might, before October 9th, come around to some level of consensus potentially on a few that might actually be able to transcend all of the Ontario Health Teams.
Fantastic. So again, I'd encourage you to go to the community of practice and post the question, or we can post it to try to get people to self-identify. One thing that we've mentioned to our ministry colleagues that we hope they'll consider, but this won't solve your between now and October 9th problem, but as soon as October 9th passes, to think about adding a column for the, there's the description of all the teams that have been invited to full application, and it just has a few columns like contact. But one thing that I think many people would find helpful is what are the prioritized populations, so you can quickly identify matches. And the moment they do that, what RISE could then do is say, here are the 15 teams looking at this constellation of population segments that are similar here, and then those teams can work together. But in the short run, the most efficient solution would be posted in the community of practice in the hopes that people put their hand up. When we interact with teams, we hear a lot of similarities in the priority population. So if we can get those groups talking to each other sooner than later, it would be very helpful. Other questions or comments from folks in the room? As I say to students at Mac, I'm comfortable with silence, so I'm going to wait you out while you think about things that would be helpful to talk about. And if you have things that you think you're doing particularly well in your team, share them with folks. My sense is, that folks are very keen. If some team is a step ahead of others, they want to hear about it. And the lovely thing is you're not competing with each other. The aspiration is that every team is successful. No questions on that quiet online presence? Okay. Davey?
Okay, thank you. It's David Chen. Just follow up some questions. This tremendous important transformation. We all talk about data. And John, you allude to some of those domains, particularly on the ministry side. How is that in line with the e-health and digital? Ultimately, we need solid data. We have the IDS data, we have the ISIS data, we have all different type hospital and community and primary care data. What is the drive in the next few years to really link or have a platform? Kaiser Permanente is successful, Columbia is successful, and then the new healthcare delivering system they call Heaven, actually established by three major companies, Amazon and the Berkshire, the one of the most successful investor in the world, and also one of the major bank, the biggest bank in the world, and their organization, their population compose and drive the all common data. So in Ontario, how do we, for OHT, that is most important, I'm thinking is we need solid data to make valid decision.
Absolutely. So, I alluded to before that, Ontario health teams are an incredible transformation in their own right, but my sense is that the ministry is seeing this as an opportunity to really up our game in a few areas. And the one that, to me, is the most visible is digital health. And digital includes both digital health solutions like patient portals, so every citizen of this province should be able to access understandable lab tests, other things that are visible to providers, but not them. But the other thing is about the data platforms. And so if you read what the ministry's aspirations are for teams at maturity is that they have this incredible integrated data platform that includes patient-reported experience and outcome measures that covers all sectors. So this is an absolutely essential piece, and I think that this is an opportunity to take us from where we are now, which is very far behind many other health systems in terms of our data platform, and take us into the modern age. And Ontario health teams have this opportunity to help steer that and to say these are the types of data, the types of analyses presented in the types of ways that we need to make informed decisions now that we're heading down this path, and that will guide that architecture of those data platforms. So my sense is that's happening, and we hope this week, and if not this week, next week, we anticipate that the ministry will release its digital health playbook, which lays out the architecture for this. It also lays out through a set of policy documents what the new terms of engagement will be, and I think when it comes out, it will really set the stage for us to move far. We recognize that it's coming a bit close to the October 9th deadline, but remember, we can't do everything at the same time. And between now and October 9th, you want to do as much as you can to talk about your short-term digital health priorities, and also, very importantly, how to move whatever you're doing in digital health to 100% coverage. So we have all these lovely pilots, 10,000 people can access a patient portal, but you have to, at the end of the day, it has to be available to everyone in your attributed population. So the digital piece isn't just about the what, it's about the coverage. And so you're not going to be able to do everything by October 9th. You're not going to be able to do everything by year one, but you need to be able to talk about a very staged and thoughtfully designed process that will, by maturity, get you to that. But I think there are many conversations happening at the provincial level that will help us get to that data platform we need. And in the short run, if this region, I don't know if Chatham Kent, do you use IDS? Is that yes? Okay, so that's a platform that's now ready to go that offers the prospect of bringing in the primary care data over time, the community care data, and most importantly, link it in a longitudinal patient journey where you can see them moving around in different parts of the system. So that's an excellent base from which to build. Carrie, still no questions from our online colleagues? Yes. Yeah.
I'm just going to ask a very specific good morning. I'm David Fry. I'm from Care Partners, a service provider organization from Home and Community Care. Yeah. And we're a member of the Western Ontario Health Team. Super. I just want to follow up on the Integrated Data Store, IDS, and the home care database, a very specific content question, so I don't know. Some people here may know. Does the IDS include non-patient identified assessment outputs that may be completed, like the inter-RI home care assessment or the CHA? Okay.
All the inter-RI stuff.
So that's
the
available
care,
to the
team.
team.
Long-term care, all of that is in the database, but keep in mind that in every community, it's about which local partners have chosen to contribute data. But certainly communities where all the partners are contributing, all the inter-RI data is there from home care, long-term care, other sites. For Chatham Kent, are the inter-RI data getting in from home care, long-term care, and other places? Yeah, great. And what about with Western? Are you aware of whether all the inter-RI data is getting in through contributing partners? Yes, great. Makes sense? Yeah. Other questions or comments? Otherwise, I'll just give you the 2-minute warning bell. If we don't have any questions within the next couple of minutes, we'll bring the WebEx to a close. For those of you who've come in person, we'll close off the WebEx. And then if you want to have a quick conversation about other issues while you're not being audio recorded and listened to by the ministry, we'll stay on and have those conversations. So, Carrie, did someone else? No, I thought you put your hand up. Davey.
Yeah, so it's David Chan again. So as the acting dean of medicine and dentistry, I would like to put a plug for the opportunity arise for OHT in Ontario. Despite we come behind in the US, but this is not only for clinical and community and healthcare, but tremendous opportunity for us with our partner in the region to integrate our medical education. We need our future physician and healthcare team, interprofessional team, to implement and sustain what we're going to make changes in our region, in the province. So I really like the OHT team and the ministry. Doesn't matter which branch. Hopefully that can surface back to the minister, that the education side and teaching and training our new generation of physicians that be able to sustain and flourish this for our citizens.
Super, very helpful, Davey. And also, for the healthcare providers that are already in the system, one of the many ways that we've intersected with this topic is when we think about leadership, we often think about physician leaders and nurse leaders and others, but the future is going to be distributed cross-sectoral leaders where the home care leader needs to be sitting down with the primary care leader and so on, and they need to be working together. So even the future of leadership training with your excellent business school right here, to us, that's got to be about distributed cross-sectoral leadership, and people need to go through leadership training focused on the skills for that as opposed to the individual physician leaders. So I think this has ripple effects through many aspects of how we approach education and continuing professional developments, because I think this is a very different future in terms of the types of capacities that people need to bring to the table. Yes? Yeah.
Sorry, Matt Meyer again. I just thought I'd make a couple of comments on
things
I had. One's around that leadership, because I completely agree. I think it's critical. And at IVU, that we are actually developing some programs specifically around this and around value-based healthcare, so that we can. We've got education programs that are coming down the pipe, because that's such a big part of what we need to do.
Yep.
I wanted to make a comment as well around the IDS platform and that digital health element, because I think having worked a lot and, as I said, very closely with IDS, they do a wonderful job of linking some of the data sets that we currently collect. The big challenge that we have is that it's not timely. Right, so it's the information that is put into there and it's a couple months old. They've done a wonderful job of trying to move it up, so it provides you really nice information for being able to monitor system performance, but it doesn't give you that real time. I need to pull up the information right up front, and that is something that we are trying to embed in the Western OHT application. I think others should as well. And I'm definitely interested in learning what others across the province are doing in that front, because we continue to hear from our clinicians in particular that if they don't have the information in visit, then
it's not going to be useful. No, hugely helpful point. And the hope would be that as we move forward, that many of us have conversations about how do we build on IDS, or if it turns out we move to another solution, how do we get it to where it needs to be? And that timeliness, I agree with you, is going to be absolutely essential. One of the things that we've heard is that IDS plans to kind of restructure, create a dashboard essentially for teams that are already contributing data that will allow you to monitor performance using kind of OHT type language, which I think will be hugely helpful. But we do need to get to that real-time access to data. So last call for any questions or comments.
Yes. Hi, it's Carol Walters from the Alzheimer's Society.
Yeah, could you turn on your mic?
I did.
You did, fantastic. Yes. Sorry, Carol.
No problem, and I'm part of the Western OHT team. And Dr. Chang brought up a really good point around sustainability, and we see the building blocks, and that's getting us to a point of full implementation eventually. But sustainability is going to take a much broader system to be able to support that. So is that something RISE is going to think about? As I know we're early, so I think we need to evolve there, because those sustainability pieces need to start implementation probably now as well.
No, I think fantastic. I'll be honest with you that until a conversation yesterday, the word hadn't cropped up, but we were in a conversation yesterday where someone said, if we don't start planning for this now, we're going to end up in trouble. And it came up in the context of the space RISE is working in, which is trying to build linkages with excellent centers like Medici to figure out how do we position everybody so they can contribute. But even just on the support side, how do we think about sustainability? So there might be a little front-end loading with funds, but we need to figure out how does this just become kind of core business for us. But then when you come to the teams themselves and partners like the Alzheimer's Society, sustainability piece is essential. So as of yesterday, it was on my radar. Because of your comment, it's higher, so we'll inject that into our thinking and the other conversations we have in future. And before I forget, every meeting we go to, I'm impressed by different things, but I have to say that across meetings, one of the things is that the Alzheimer's Society is almost always there in every community we go to. So you seem to have an incredibly engaged, distributed network of folks that are at these tables, which is great. I'm sure it takes a huge amount of time and effort on the part of the organization, but it's fantastic that you're getting to these meetings.
Yeah, we're fortunate that we have a governing, or sort of a federation that bonds us all, but Alzheimer's Ontario has done a great job. We have weekly meetings every Wednesday morning to bring all of us together to talk about what's happening in each of the regions. So again, because we're such a broad provincial organization, I think that's really important. So So I appreciate your comment.
Well, and we're hoping to highlight it as an example if we go ahead with this webinar about how to intersect with regional resources, because yesterday we had someone from the Ontario office at a session, and it just seems like they're managing that well, whereas other people are really feeling stretched and they don't know how to field people for multiple meetings while they're still trying to keep their own organization moving forward. So any final questions or comments before we wrap up with the recorded part? All right, so to those who are online, thank you very much for joining us on the WebEx session. We'll sign off on that right now, and we appreciate you joining us. And as I mentioned before, the slides are available online.